Academy FM Folkestone
on 105.9 FM
and online at academyfmfolkstone.com.
Now, did you know, we didn't until we read this, that 1 in 4 people in the UK has irregular heartbeats, and that's a leading cause of death in this country. More details from Dr Hilary Jones. Good afternoon, Dr Hilary.
Good afternoon, Bob.
Thank you for joining us today. We're also joined by our studio manager, the station manager, Dave Sharp, who thinks he has that problem. So he'll be firing a few questions to you, if that's okay.
Of course.
Now, this is, it seems incredibly serious, and it doesn't seem to be very sort of aware. We're not aware of this. How's this come about? I mean, you talk about heart rhythm disorders. Exactly what does that mean?
Well, we're talking about any abnormal heart rhythm. Normally, our hearts beat about 70 beats per minute at rest. They get faster when we're exercising or anxious and stressed, and slower when we're asleep. But that's the average. But a lot of people will have a heartbeat which goes too fast, too slow, or irregularly. And it's very common. A few people will have an underlying cause which is potentially serious, like Fabrice Muamba, the footballer who collapsed on the football field, had a cardiac arrest and had to be resuscitated, which certainly hit the headlines, didn't it, recently?
And he had this problem, did he?
Well, he had an underlying abnormality which caused the cardiac arrest. The rhythm of his heart became disordered and irregular, and it ended with a cardiac arrest. Now, that's an exception, really, because most people will get palpitations or faintness or shortness of breath occasionally with their irregular heartbeat, and then it'll pass. And often it's due to a lifestyle factor as simple as drinking too much tea or coffee with caffeine, being stimulated by stress or anxiety, or having alcohol, being tired or dehydrated. Most cases of palpitations and abnormal rhythms are short-lived and benign, but you just don't know until it's investigated and looked into.
And how do you know that you have this, so that you're motivated to go and see your doctor?
Well, most people will notice a thud in their chest as their heart skips a beat, or a feeling of their heart racing, even sitting at rest quietly in the evening reading a paper or watching TV. Some people will notice a fluttery feeling in their chest and feel anxious as a result, feel they can't breathe normally, feeling faint. If that happens more than once or on a regular basis, then you probably ought to go and get something checked out. I mean, certainly go and see your doctor. And there's a very useful checklist which has been designed by the Arrhythmia Alliance, the heart rhythm charity, and you can get a copy of this checklist to fill in and take to your doctor if you're worried, to make that consultation more efficient. And the way to get hold of it is to go to the website, which is heartrhythmcharity.org.uk.
Right. You mentioned about the stimulus of tea, coffee and alcohol. If it only happens then, and you then reduce those three to some extent, and hopefully most people's will disappear, will they, irregular heartbeats?
Yes, there's a good chance that that'll solve the problem, and dealing with stress and anxiety and restless nights will solve your problem. But if it continues, it's very reassuring to go and have it checked out, because the more you worry, the more you're likely to suffer palpitations as a result of the adrenaline that you make.
It's interesting you mentioned those stimuli, because Dave Sharp, with us here, had those and recognised it, didn't he, Dave?
Yeah, I did. I was one of the people, I think there's quite a lot, who, when you're lying in bed at night, just about to go to sleep, and then I noticed that something was funny. It felt like I had indigestion or something like that. And I started counting my heartbeats. I just thought something was funny. And then I realised I was actually skipping a beat. And that was at a time when I was probably drinking too much coffee, which I've cut down on a lot. One question that I've got, though, is I tend to exercise quite a lot. I ride a bike into work maybe 3 days a week or something like that. And on the couple of times that I've noticed that I've had an irregular heartbeat, it's been at times when I actually haven't had any exercise that week. Am I noticing that correctly? Is it right that if you actually give your heart a rest for a while and kind of change the normal rhythm of your activities, that change in the heart's activity can bring on this irregular heartbeat?
No, not really. It can happen at any time. But actually, the fact that it happens at rest is a good sign. It's a very reassuring sign. It's much more worrying if your palpitations occur when you're exercising. For people like me who get palpitations, I have 7,000 extra beats a day, but I never have an irregular heartbeat when I'm exercising. It's only at rest, which is the common pattern of benign abnormal rhythms. So if they're happening at rest, that's a really good thing.
Okay.
It's when you're exercising that it becomes more serious. So that's reassuring. But no, they can happen at any time.
Okay. Now, in terms of treating this, I gather you've got Joe Brooks in the studio with you.
Hello.
Who's now you've suffered from this condition and are wearing some sort of device that helps you. Isn't that the case?
Yes, definitely. It's a little defibrillator that's implanted under the breastbone.
Right.
And it just kicks in when there's any abnormality rhythm that picks up and stimulates it back to your normal heart rhythm.
And is this an easy... I mean, you say it's under the breastbone, so is that actually implanting it as some sort of surgical procedure?
Yes, but it's only day or overnight stay. It's a very short procedure, doesn't take long, and you don't even notice it's there. I wouldn't even know it's there. It doesn't affect me at all.
Okay. And a question for Dr. Jones. Is this the way that it is always treated, or is there kind of simpler forms of treatment for more milder cases just involving taking a tablet or something like that?
Absolutely, yes. I mean, Joe's case is a little exceptional in that not many people will need a defibrillator. Most people can get by if they have frequent inconvenient palpitations by taking a tablet. I mean, a common tablet is a beta blocker type tablet, which just regulates the heartbeat by reducing the effect of substances like adrenaline, which makes the heart rhythm a bit more sort of jumpy, if you like. So a beta blocker will just calm everything down and make the heartbeat regular. And all it needs is a tablet each day.
And is this problem, is it a prelude to somebody possibly needing a pacemaker eventually?
No, not necessarily. Not in most cases. But if we establish that there is a heart rhythm disorder, when we look at the electrical configuration on the electrical recording of the heart, and we can see that in the electrical system of the heart anatomically there's a pre-existing problem, then if we think that could lead to a problem in the future, then we need to make sure that someone has a remedy there to help them if it happens in the future, and that means a defibrillator. But as I say, that's the minority of cases.
Yeah, and for somebody's partner, perhaps you're watching television or you're in bed and you feel this, and your partner is obviously extremely concerned.
Yeah.
Middle of the night, should you phone 999?
I think it depends on whether this is an occurrence you're used to and whether there are ways of dealing with it. Some people, for example, can learn to rub on the carotid sinus, which is at the base of their neck, or around the carotid artery, and that can stimulate nerve signals which slows the heart rate down. And some people can learn to do that. So if you've become trained in dealing with it and you're happy, fine. But if it's something that is unusual, out of the ordinary, not settling down with self-help measures, then clearly you do need to get advice. You can either phone NHS Direct, or if you think it's more urgent, you can phone an ambulance or take yourself off to the A&E department and get it sorted.
Great. Can you just remind us of the website for more information?
Yes, please. It's www.heartrhythmcharity.com.